Okay, so you guys, we're going to do the APGAR score. We talked about that. You guys are going to do the physical assessment, and of course, typical heart rate for how long? 1 minute, and it should be what rate? 110 to 160. You guys know about measurements. You guys, the bands have to be applied before they leave the room, and footprints to prevent, well, for identification purposes. These are hugs. These are some, we have to use the orange part. This is the moms, so if they get separated, the moms will go off, but some of them just have just the leg one. Of course, we're going to do the newborn reflexes and Ballard score, and we all know about the Ballard score, and that's what completely objective. After we do the Ballard score, we're going to chart, so we're going to look at, on our Ballard score, let's say we're at 38 weeks, okay, we get a Ballard score of 38 weeks, and our weight is 3250, let's say 3250 right here, so we can say that that's in the 50th percentile. If they're in here, this is average for gestational age. If they're down here, that would be what? Small for gestational age. And up here, large for gestational age. Okay? Gestational assessment, classification by gestation. Preterm is less than 37 weeks. Late preterm is 36 weeks. They're still preterm, but they're late preterm. Term is 37 weeks, but full term is 40 weeks. We're starting to use that word, full term. We want you to go full term, meaning we want you to go to 40 weeks. Post dates is after 40 weeks, and then post-mature is 42 weeks, okay? You guys, airway, so somebody, you know, I tell you guys, when the baby comes out, it's your responsibility to suction the baby, right? So you guys, if the baby's crying and doesn't need suctioning, do you suction the baby? No. But who is the person that is responsible for suctioning the baby if they need it?
Nurse.
The nurses. Lenore.
Leah. That was close.
Yeah.
So at US Health they said they don't do the sectioning anymore. They said that the evidence shows that they don't need to do it anymore.
Well, if the baby needs to be suctioned, and there are times that the baby needs to be suctioned, that's like one of those things that they're saying the evidence says you don't have to suction everyone. I totally get that. But dudes, people who need suctioning, because these babies have a lot of stuff and they cough up all this stuff, if they need suctioning, do you need to suction them?
Yes.
Yes. You do it on the side. Obviously, we all know how to use this. Everybody good there? You guys don't, anybody who's being suctioned, you don't keep suctioning, keep suctioning, keep suctioning. What do? You allow a break for them to re-oxygenate. It's the same thing with trachea, right? So if this baby is having a hard time, give the baby a break. Don't keep suctioning. Supplemental oxygen. Eye prophylaxis, and what are we giving this for? Chlamydia, chlamydia gonorrhea, which can cause blindness. And where do we give it? In both eyes. And what is that abbreviation? OU. So the right eye is oculus dexter. The left eye is oculus sinister, and OU is oculus. No, what is it called though? It's a Latin una, but it's both. You do need to know that.
No, I mean like the whole.
No, O-U-O, O-D, O-S, and O-U. Yes, you need to know those. You guys didn't learn those?
Health assessment.
Right is O-D, left is O-S, and both is O-U. So CDC says it can be delayed up to 2 hours. And dudes, here's the deal with this. Dudes, in a perfect world, if you tested negative for chlamydia and gonorrhea, I would love to be able to say that we don't have to put this in your baby's eyes. Okay? But we do not live in a perfect world. And your vagina could have got contaminated last night when you had sex with your husband who had sex with somebody else the week before. Okay? So dudes, it's not up for debate. You know what I mean? Like this one, both of these, vitamin K or this one, they're not up for debate. And I just say, well, and I usually say this, there's a lot of bacteria down there that could get into the baby's eyes and cause an infection. Because that's true. Is E. coli there? Could that get into the baby's eyes? Yes. But blindness can result from chlamydia and gonorrhea. And we're going from inner to outer. Vitamin K, what does that do? Start the clotting cascade, right? Does everybody need this? 100%. Because if the baby had trauma to the head on the way out, do you want it to clot off? Yes. I am. Vastus laterals, here it is, you guys. 90-degree angle, straight in. People are like, JBT, do I aspirate or no? So dudes, with vaccines, we're going to no aspiration, okay? But we're in the hospital, we're in a controlled area, we have these babies, so aspirate just to protect ourselves. Support, breastfeeding. You want to do that in the first how long? First hour. What happens after the first hour? What is that first hour called? The transitional, the first period of transition. And that's when they're like this. What? But then the cops go home. Then what happens? Crash, and you cannot feed them until the baby wakes back up again. So you guys are good with assessment of this. 25 is what? Small. 4,000 is large. I'm not going to make you memorize. I'm going to show you what you're going to have to memorize. You have to know those weights, okay? Here's the baby being what? That guy looks what? Large. Why does she have this thing on the scale? Convection. Prevention of loss via convection. Okay, so dudes, how much? What are eyes and nose in a baby? Eyes and nose in a baby. So you're supposed to intake or breastfeed how often? Every 2 to 3 hours, right? So you're supposed to breastfeed every 2 to 3 hours. You're supposed to bottle feed a minimum of every 4 hours. So there's your eyes. So do you have? Yeah, we breastfeed every 2 to 3 hours. And we need to bottle feed at least every 4 hours. Because what's the difference between bottle feeding and breastfeeding? Volume, right? With bottle feeding, are you going to get a lot more volume? Oh, of course, absolutely. Okay, so there's your eyes. How about your O's? So on day 1, you should have 1 poo and 1 pee. This is very difficult. This is a hard thing to memorize. It's going to get harder here. On day 2, 2 poops and 2 pees. On day 3, 3 poops and 3 pees. Day 4, 4. So dudes, if you're behind, we know that it could be an eye problem, right? An intake problem. You may not be getting enough at the breast. So here we go. Here's meconium. Has everybody seen meconium now? Is everybody happy? Big tarry green. This is transitional stool, loose and seedy and brown. It's really nice. Breastfeeding stool doesn't smell because there's not a lot of bacteria in it already, and it's not sour. So that's kind of, I mean, it's terrible. I'm saying how nice food can be, but. And the bottle-fed newborn stool looks like your stool. Well, less, but like your stool. All right, so let's just look at some common variations. What is this? Bruising. Yeah? Dudes, what do y'all think happened to this guy right here? Shoulder dystocia. His head was hanging out, and blood was going to his head, and his carotids were compressed, his jugular was compressed, so all that blood was just sitting there not moving, and he was just bruising. So dudes, so this bruising would be what happened to the vasculature. It was broken. If the vasculature is broken, tell me what happens to the stuff inside the vasculature. Leaks out. And what happens to the red blood cells? Lyses. And what's inside the red blood cells? Bilirubin. So dudes, is he at risk for an elevated bilirubin? Absolutely. He's really mad too. I feel sorry for him. Mottling. So mottling is just decreased oxygenation to the skin. We see this with drug babies. You guys anybody remember our drug baby we saw this with? It looked classically like this. But it can just be from a normal change of circulation. Harlequin sign, not to be confused with Harlequin's disease. Harlequin's sign is when you have the baby laying kind of on the side a little bit. The bottom part will be red and the top part will be well, the gravity-fed area will be red, and the top part that's not gravity-fed will be whiter or like a Harlequin. But it goes away, it's transient. Harlequin's disease is inbreeding disease. I just have to show you a picture because it's very exciting. Because don't you like weird stuff with your nurse? Do you? Yes.
So the blood just pools, is that what it is? Like,
Yeah, pools.
Whoa.
oh, I've seen that.
It's from inbreeding. Yeah, same DNA, same genetics.
That's
What is it
real?
from? It's real. No, it's Harlequin's disease. It's more than that. This is like the whole disease. The DNA is too close to each other, and so you get this with Harlequin's disease. So this is Harlequin's what? Sign, not Harlequin's disease. Dude, you guys all know that when you go home from clinical and there's something really bad and gross and cool in your life, dude, guess what happened? If you guys aren't like that, stop nursing. That's what makes it interesting. Erythema toxicum. Erythema means? Toxicum means with a white center. And what is this? Normal newborn rash, baby acne. Is it a terrible, horrible thing? It's a normal thing. It just looks bad and it goes away. We had a bad case in our part where this whole kid's chest was just covered. I felt so sorry for the mom because it just doesn't look right. What is that? Do you guys identify this stuff on a test? No, dudes, is this actually Lanugo? No, this is not actually Lanugo. This is heritage. Okay? She's got dark skin. She's hairy. Baby's dark skin is hairy. Dude, Lanugo is what? That fine white hairline. But this was in the slides from the textbook, so I use it in here to keep it. Subconjunctival hemorrhage, is that okay? It's okay. It's from the pressure of the baby's head coming out. Okay, it'll go away. Jared?
So even in babies that feel like in the darker ethnic group,
Yes, absolutely.
they'll have the white hair. They
The
don't-
white hair is Lanugo. That white
Okay.
clear hair,
Okay.
this is ethnicity.
Okay.
But nurses will call it Lanugo, I'm like, maybe
But
that's
it's not. It's
ethnicity.
not white.
So dudes, this subconjunctival hemorrhage, it's normal in babies just because from the pressure gradient, from the head being out of the vagina. And did they go from high pressure to low pressure so they can just blow a vessel in their eye? What are these? Epstein pearls. Where else do they have an Epstein pearl all the time? On the roof of their palate. Have you guys felt that or seen that in the palate? They have an Epstein pearl. Is it normal?
Yeah.
Yeah. Transient Strabismus, so dudes, what are they focusing on in utero? Nothing. It's a dark cavern. So when they come out, they may have a weak eye muscle. So all that, dude, this is so normal, and people freak out around like, dude, it's totally fine. We just, what do? We usually patch this eye to strengthen this eye. It's just an eye muscle issue. Epithelial folds, who is that normal in? Who is it normal in? Asian population. Yeah, Asian population. Who is it abnormal in? Everybody else. So you guys, if they have epithelial folds, we worry about chromosomal abnormalities, right? So you guys, did this baby boy, let's just look at a supernumerary nipple. Okay, see this, you guys? This is what an extra nipple looks like. And it's so funny, I was in Orange Park one time, and I had this FCCJ student, and this baby has a supernumerary nipple, and I'm like, oh, here's an extra nipple. She goes, is that what that is? Whips her shirt up. Dude, there's glass. It was like a glass bubble, because they I was like, she whips her shirt up, she goes, is that what that is right there? And I was like, please put your shirt down. I was so embarrassed. Like, I was just like, oh my God, her boobs are showing. It's not cool. But anyway, lots of people have these. Lots of people have these. They're non-functional. But this is breast tissue, you guys. It goes in the milk line. This is the milk line. It goes straight down like this. It goes here. This is the line you usually see these in, the milk line. And you guys, it's not functional. And sometimes the pediatricians are like, I always say just tell them what it is. You know what I mean? The pediatrician's like, they're kind of histrionic. And let's just tell them it's a skin, just a little dark skin area. But anyway, you have to check for breast cancer there because that's breast tissue. So you do need to palpate that and make sure there's no lumps or any changes. Oh, but I was going to tell you about boys and little girls. So does estrogen cross the placenta? Yeah. So you guys, these little boys come out with linea nigra, right? So they have all that estrogen, and when their prolactin falls, and if they're being stimulated, they can have a discharge from their breast called witch's milk, which is not witch's milk, it's endocrine milk. Right? I mean, it's a function from prolactin and just them stimulating the baby. So you guys, it's totally fine, it should go away within 2 weeks. Cleft lip and palate, so here's, you guys, we know that this is 2 things, congenital and, well, it's genetic to some extent, and environmental. It's 2. And you guys, this happened when the midline closed early in organogenesis, very, very early in organogenesis. So you guys, here is just a cleft lip. Here is a unilateral cleft lip and palate, and here is a bilateral cleft lip and palate. So you guys, we have special nipples for them because they can't achieve suction, right? Because they have an opening and they can't get good suction. So we can, what we do is we pump. We definitely have moms pump if they want to breastfeed. So we have them pump and then we give it to them in a nipple that doesn't require suction, that just kind of drops it down. Now dudes, I do have to tell you that this is like years and years and years, like 18-year-olds are still getting surgery. They take the bone out of their hip and they replace this. I mean, it's like surgery after surgery after surgery, and you're hoping by the time that they're 18, they're good to go. Sometimes we have to take their teeth out and do implants because this bone grafts don't hold well, and the bone grafts cause problems with their teeth. So sometimes we have to put full implants, you know, in for all the teeth.
How often is that seen at severe?
Not often. I don't know what the actual incidence and prevalence is, but it's not often. You guys, this is hypospadias. So here is a hypospadias. So this is where the meatus is not centered. This is where it's low. Here's on the shaft, and then here is on the testes. This one we can repair, you guys. We just don't do a circumcision. We send them to urology, and they can repair this one. But this one, you lose your ejaculatory response, and that's hard for a parent. You know, when there's a hypospadias on the testes, to think that their son lost the ejaculatory response. So that's that one. And then epispadias is on top, okay? And this one has, if it's anywhere on the penile shaft, you'll have an ejaculatory, what did I say? Response. But if it's down here, you do not. So this one has. And you guys, they correct these in urology a lot. This is feminizing testic. This is a ambiguous genitalia. Thank you, Ryan. Gosh, I really need a copy of diet. Ambiguous genitalia, and you guys, sometimes from progesterones, having like being on Depo-Provera and getting pregnant and having excessive progesterone, they say that can cause this. But when it comes out like this, you don't ever want to say what it is or what it isn't, right? You don't ever say, and you don't talk about it, because the words you say, they remember, and we don't know.
So when you're shoot for, is that what it is?
Did you say it?
No, the baby. Yeah, don't call it it. Call it the baby. So you guys, what would we do to find out DNA, you guys, and ultrasound? We try to see, do they have a uterus? Do they have ovaries? Do they have testes? Is it cryptorganism? What's cryptorganism? Non-descended testicles, which this could be with a micropenis. We don't know. Club foot, this is where the foot's turned in. And you guys, this is positional, lack of amniotic fluid. And you guys, all we do is we repair them and cast them. Okay, we repair them and cast them. Down syndrome, trisomy 21, extra chromosome. And you'll learn more about this in pediatric. Omphalocele, these are where some of the organs are outside, deviated out of the umbilicus. Okay, this is omphalocele. This is hard. Okay, this is really, really hard. I did read a really interesting article yesterday about PPIs, so proton pump inhibitors, and pregnancy in the organogenesis phase can cause gastroschisis. there's a mild assimilation, there's a mild correlation in gastroschisis is when all the intestines are on the outside. Okay, gastroschisis is when all, and what we do with that is we put a tent over it and then push it in a little bit every day. It's very effective, very, very effective. But this omphalocele, you guys will have to go to surgery for that. So would you ever lay them on their stomach? No. Of course not, Julie. Soap gauze. Dudes, anytime there's something wet that's out in the air, you always, for nursing NCLEX, put a saline soap gauze on it, okay? You'll be good. Myelomeningocele, you guys, this is also called what? Spina bifida. Yeah. So you guys, here's the cord, it's out, it's open. And you guys, we lay them on their stomach, right? And of course, we can put a saline soap gauze. Protective reflexes, these are things that keep the airway open. Why do drug babies sneeze?
Respiratory.
Congestion. Do they have all this fluid up here? So they're just trying to clear their airway, right? So sneezing, gagging, and yawning, that helps keep the airway clear. And you guys all know sucking, swallowing, reading, extrusion, moro, plantar palmar grass, tonic neck. Also called the pincing. And then stepping and walking, that's what this tiny 2-pound baby is doing here, is walking home. Dude, I don't actually do that in clinic, I just touch their feet, because dude, people would think we were freaks. If they saw through the window us doing that to their baby, they're like, what are you doing to the baby, right? So you can touch them. And then Babinski, is it normal for a baby to have a Babinski? Yeah. What is this one? Palmar grass. Breeding. So you guys, the bath needs to be delayed. Orange Park's delaying 24 hours. How about Baptist? What are they delaying?
24.
24. How about Shands or UFL?
24.
24 UFL? Or you think Mickey or no?
I mean, Evan
guessing?
takes practice,
No,
right?
I know 12 to 24. 12 to 24. Okay. How about, say these? Say these?
Yeah.
Wasn't? So dudes, here's the thing with this, is that when we bathe them early, we know we're dropping their temperature, right? If their temperature drops, what are the other two things that can happen? Their glucose can drop, and what else? Respiratory distress. So you guys, this is why we're big proponents of delaying bath, but you guys need to wear gloves because they have blood and stuff in their hair, chlamydia, gonorrhea, HIV, whatever you choose to have. And so you have to wear gloves when you're touching them until they have this bath. Oh, here it is. This guy's really happy looking up. He's like, yeah. Okay, so you guys, cord care, what do we do with the cord? Nothing. We just look at it and make sure it stays dry and clean.
Make sure it has 3.
Make sure it has 3 vessels, right? Always 3 vessels. So you guys, what are signs of infection with the cord clamp? What with the cord? Erythema? Pardon? Heat?
Discharge.
Virulent discharge? Yep. Heat, swelling, redness,